There's one over here
Former
too.
U.S. Senator Roger Jefferson, if you want to speak.
All right, Andy, I got 5:30 and the live stream is up and running.
Okay, we'll call the meeting to order. Jackie, you've got the roll call.
I do?
If you can stand if you are able and join me for the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Vice President Jan, I will turn the gavel over to you for administration of the meeting.
Okay, thank you, Mr. Koob. Agenda's in front of us, any changes or additions to that?
No, sir.
Okay, is there a motion to approve the agenda?
So moved.
Second?
A motion second to approve the agenda, all in favor signify by saying aye. Opposed?
Aye.
Motion carried. We'll skip the communications portion of that and allow others to address the board after we introduce the piece about new business. So, move down to new business. Consider mask requirement for students and staff in grades preschool through 12.
So,
Short.
yep, so included in your packet, I have my recommendation. I have a couple supporting pieces of data. And I'm just going to read from what's on that recommendation. Due to the current positivity rate in Lyon County, the number of students and staff who have tested positive, who have been required to quarantine due to close contact, Governor Reynolds' updated proclamation from Monday, and guidance from the Iowa Department of Public Health regarding the wearing of face masks, and feedback from our local healthcare partners, Avera, Sanford, and Lyon County Health Services, it is my recommendation that students and staff in grades preschool through 12 be required to wear a face mask while at school, regardless of the student or staff's ability to socially distance. The exceptions would be when participating in physical education classes, band, outdoor recess, and athletics, and also while eating and drinking. The board may also want to consider some other options, and I've listed those 1, 2, and 3 below. And I think that conversation will start here in a little bit, but I'd like to kind of go through the two pieces of data that I included for you. So the first page has the number of students positive or quarantined over the course of this last week. And then at the bottom of that page, you have the number of staff who have absences related to COVID, whether they've been positive themselves or they've been, they might have daycare conflicts because of exposures within their family. They've had to stay home and take care of their kids, or other reasons, but connected directly to COVID. Now, in addition to those, we have other staff that are out because of other appointments and other responsibilities, but I just included here the absenteeism directly related to COVID. And then at the very bottom, you can see our positivity rate here in Lyon County. So, the thing that has really changed over the course of the last week is the positive cases in our elementary and the close contacts associated with that here at school. And so, right now, today, 78 students either positive or quarantined because of COVID. And of those 78, 12 of them in preschool through 4th grade were determined to have been in close contact here at school. And so that's really been the impetus for this, in addition to our conversations with local healthcare providers, Avera and Sanford, and then our continuous conversations with Melissa and Lyon County Public Health Services. So, in our conversations with the 3 of them and the other 2 schools across Lyon County, we took steps to try to slow the spread, which led to cancellation of junior high activities during this week and next week leading up to the Thanksgiving holiday. And the postponing of the girls' high school basketball game on the Tuesday before Thanksgiving. So with the governor's proclamation on Monday and kind of limitations on gatherings across our entire state, I felt that it was appropriate for the board to reconsider expanding the mask requirement for all students and not just the 5th through 12th grade students that we implemented back in September. So that's the data. Today I issued a survey to staff members, elementary and middle school, 2 separate surveys. So the first page there you have is an elementary only preschool through 4th grade staff members. 26 responded, and as you can see, about 73% is what it comes out to support requiring preschool through 4th graders to wear a mask when unable to socially distance. And then it's 15 to 11 as you move through the different kind of levels. So my recommendation, still a majority, but not, the 73% that it is for when unable to socially distance. And then the middle is the same as the unable to socially distance, but that includes hallways, lunch lines, and common spaces. Same 73%. Okay, and then on the back you have kind of a breakdown by grade level of the teachers that responded. And then the second page was high school and middle school staff. And this is in reverse order. So high school and middle school staff, the first question at the top explains, do you support expanding the mask requirement to 5th through 12th grade students and staff to wear them at all times except when eating, drinking, during PE, and outdoor recess? And that 22 to 8, ironically, is also 73%. And then question 4 is, do you support continuing the mask requirement as it currently is written is 50-50? And similar on the back, you have kind of the breakdown by grade level. Okay. Craig, if you or Melissa would like to address the board, doesn't matter who goes first, but.
Am I sitting here?
Sure.
Okay. Well, good evening, and thank you for the opportunity to speak with you tonight. I come to represent our healthcare workers and our providers. Everything we do before a pandemic will seem alarmist. Everything we do after a pandemic will seem inadequate. This is a quote by Michael Levitt. The point being a reminder that we should all strive to look back after the pandemic is over and say, we are glad we did that, rather than saying we should have done more. Out of respect for our frontline healthcare workers, Avera supports a healthy workforce, keeping businesses and schools open. The pathway to this is through hand hygiene, social distancing, and mask wearing. Avera supports masking, and in communities and schools considering mask mandates, we support this measure. This is consistent with the Centers for Disease Control and Prevention, which has affirmed that wearing masks can help communities slow the spread of COVID-19 when worn consistently and correctly by the majority of people in public settings. Avera has supported masking since the early days of the pandemic. Avera is part of a national masking campaign. We have our own Avera masking campaign and countless posts and stories supporting masking at the system and local level. We have done everything short of supporting mandates because of the difficulty of enforcement. However, with the rise in case counts, it is now time to reevaluate our approach. Today, There are over 50,000 active COVID-19 cases in Iowa and over 1,500 who are hospitalized. At the start of November, there were 100 hospitalizations a day in Iowa. Now, a short 19 days later, that number has grown to over 230 and is increasing. Locally, we are seeing much of the same thing. In our northwest Iowa region, there are currently 224 hospitalized patients with COVID-19. Prior to November 1st, we were seeing 10 to 15 new admissions a day in that region. Today, we are seeing between 30 and 40 new admissions a day, 42 in the past 24 hours. Lyon County has the second highest positivity rate in the state and is ranked 19th by cases per 100,000 people. Things are changing rapidly, and over the next few weeks, we could see a large increase in patients according to predictive models. We take this increase and predictions very seriously, and we continue to plan accordingly and advance through the stages of our surge plans and advance through our surge plans to accommodate these increased needs. This is challenging and tiring for our healthcare workers. Now is the time that we need your help and support to do a change so that we can change that trend and support our healthcare workers. The mask mandate before you today is appropriate, and I strongly encourage you to adopt them as recommended so that we can look back at the end of this pandemic and be glad that we did. Thank you.
Thank you, Greg. Melissa?
So from a public health perspective, what we've seen this week is the number of cases in our county. We started, like on Sunday, we were around like 750 some cases. As of this evening, we're at 893 that we've had total in our county. It's been a very busy week. We have over 200 and some positive people in our county as of this evening. We're seeing an increase, as Mr. George said, in the number of younger students and children that are being affected by the COVID-19 virus. And so when the governor came across this week with the proclamation and the public health measures to increase the use of masks, it's because we know that when you're with people that are not part of your household, you have that high risk of one, contracting that virus and taking it to other people, and it's just gonna keep spreading the virus more and more. And so, as a health agency, and as a State Department of Health representative, we fully support that we need to see more masking. We're gonna have more masking in our communities. When people are going to the grocery store and the gas station, our churches, children wear masks to church, they wear them in the grocery store, they're very comfortable with wearing them. Children are probably our better role models as a public health perspective than anything right now through this pandemic. They're more flexible, they're more patient with things, and they adapt very well to the changes that they've had to do during this pandemic. And so the guidelines from the State Department of Health are if you are not with members of your household, then you should be wearing a mask in public settings. And so I would fully support the board following through with that mandate at this time.
Melissa, do you have any information of the particularly, I guess, the students that have tested positive, where that infection came from? Did it come from, I mean, in some cases I know you don't know because community spread.
Sure.
Is there any information that says it's coming from this source or another source?
As far as the cases that we've been working on with the state over the last month, it's honestly very widespread. We see it from community gatherings, social gatherings. There's not a lot that are from within the school system per se, from person to person. But when you have somebody who is going to the neighbor's house for the Sunday football game and they all wanna have a potluck together, and then you don't know who's asymptomatic or symptomatic because people don't stay home, then you have that risk of those people bringing it into your school system. And we're seeing a lot more of our educators, as Mr. George said, being affected by this. But to pinpoint it to one specific thing is a little difficult,
I
but
understand.
yeah. So it's kind of community, household type situation.
All right, thank you, Craig and Melissa both. Molly?
Can I ask a question?
Yes, sir.
Melissa, is there any data with the positive cases that we've had at school and the kids that have to quarantine out of that? Has there been any tracking that says 50% of the kids that are quarantined because of a positive case outside of the school get it? Or do we know how many of these kids that are quarantined that actually end up testing positive for it?
No, I do not know that, no. The state may have that data for you, but I don't have access to that.
Do you feel like that happen, I mean, do you have some idea that that does happen frequently, or is it very infrequent?
No, I mean, we do see that happen. We've had situations where we've had people go to wedding receptions. We'll just take that for an example. And we've had 25 people be infected from that. And from those 25 people, we had to do contact tracing for another 50. And out of those 50, about 35% of them ended up contracting the virus within 5 to 7 days of contact with them. And then we had some later throughout that 14-day period.
Is that comparing apples? My question being is, the stats and data says that kids are less likely to contract the virus. So are we comparing apples to apples there, that adults are going to these wedding receptions and having the contact tracing versus contact tracing with kids?
I mean, I did contact tracing this summer and as the school year began, and we still ended up with 18 to 20 people sometimes at a time with adolescents as well. As far as your particular cases with your elementary students at this current time, I have not been the one to do those investigations, so I don't have access to those specific cases.
Who is doing the investigating now?
The state.
How accurate is that? Because I've heard cases where people are getting calls 30 days after they've gone.
Well, I can tell you right
Virus.
now that our state has 55,000 active cases that they're doing contact
And I
tracing
realize
with.
that, but
So, and we have 110 people doing investigations. So. The
So
problem
there's
is
a lot
the
in this.
spread.
thank you.
Any other questions for Craig or Melissa? Okay, I believe Molly is the only one that has signed up to request to address the board, so Molly,
Okay, well, I guess
you have 5 minutes.
Okay, I was mostly just signing up in case I felt like jumping into the conversation. My apologies, I misunderstood.
No, that's fine, and if that's what you want us to do, that's fine.
Nope, that's fine. I think that, as a parent with 5 children in the school system, as a nurse at our local hospital, and now as someone who has stepped up to sub in the school because of the desperate needs that we have, I think I have a very unique and valuable opinion on it. To be honest, when I walked into school several weeks ago, I was quite disappointed to see the enforcement of what the board had currently set up. Students are not 6 feet apart in the classroom. I have yet to be in a classroom where the students are 6 feet apart. So reading the mask mandate as it says, they should be masked, and they're not. And that's disappointing, because when you guys released the mandate on the 30th, I was so encouraged that you guys were taking steps to mitigate the spread and to protect our staff and our students. That's not what's actually happening in the classroom, and that's discouraging.
But can I interrupt there?
Yep.
In the high school, our positivity rates in quarantine has been extremely low. So how can we say that it's not being effective when it's not happening?
Well, I can say that, I'm not saying that it's not being, what I'm saying is that the current mask mandate that you have is not being enforced, and it's not correct. I am sitting amongst students, and they are not 6 feet apart.
What ages are you substituting?
I've done from preschool to high school. I've done every single grade level. in Lakeview Elementary, middle school, and high school. So.
Okay.
So, to continue with that, I think that Northwest Iowa has behaved for the last 6 to 8 months as if there isn't a pandemic. I think we've been fortunate that because we live in a rural setting, it has taken this long to hit us. It's here now, and it's time to act. And it's time to act on behalf of your staff and your students and the community and the hospital workers. Because not only is COVID-19 hitting, there's still heart attacks, there's still strokes, there's still additional things that are happening. And it's gonna affect one of your loved ones eventually, and I'm tired of people waiting for that to be what makes us act. I am not perfect, my kids are not perfect. I've seen them at school without a mask, and I told them to get their masks on. And I get that it's not gonna be a perfect system, and no one is saying that masks are 100% effective, but what they are saying is they help. So why aren't we doing something that's going to help? It seems like a pretty simple decision. And if you look at neighboring schools such as Sioux Center that has had a mask date since the beginning, their numbers are dramatically different than ours. And they're not facing the same situations that we are.
Okay, thank you, Molly. Okay, so we'll move on. I think how we want to move forward in terms of decisions that we make is start with I guess what I call the most basic approach at this point, or add on to what we currently have, and see where we have support for that and go from there. So the first thing we're gonna consider is extending the current requirement of masks required when you're not able to socially distance, extending that from 5 to 12, extending that to preschool through 4. Okay,
And if
discuss that.
With the current mask mandate, I think, and correct me if I'm wrong, it's if you can't social distance the 6 feet and the 15 minutes. That, I think, is how it was when we started. And
That's
I
how
think
social
that has been a little bit updated from the CDC, where that 15 minutes is 15 minutes out of 24 hours. It's not like a 15 minutes at one setting. So I think that has maybe some confusion with when people say that we're not following some of our mandates. It's that in the hallways, we did not require that in the hallways because that's less than 15 minutes. So, and yep, you can't socially distance maybe in the hallways, but it's less than 15 minutes. So we have been okay with that to this point. Is that correct?
Yep.
I just want that maybe to be clear so that we know if we add on to this, that that's something that we have to consider also.
I'm trying to remember exactly what our requirement was. Did we put a 15-minute requirement in there?
It was when unable to socially distance, but, at the time that we implemented it, the term socially distanced was defined as 6 feet for more than 15 minutes.
Okay.
Or 15 minutes or longer. And even though the CDC has revised its guidance when it comes to 15 minutes over a 24-hour time frame, doesn't necessarily been adopted or changed any of the Iowa public health standards.
Okay.
No, it hasn't.
So,
The state of Iowa hasn't changed their guidelines.
okay, so that's still 6 to 10, 15 minutes, but it doesn't have the 24-hour
Yes,
rule.
they haven't changed that at this point in time. They're still reviewing that.
Can I comment on the 15 minutes?
Sure.
I think holding on to that 15 minutes is, I don't know that I would hang your hat on that 15 minutes, I would say. Just thinking about kids in hallways, from what I recall of school, it being quite crowded. I'm not sure if there's been some changes in terms of how kids go from class to class to maybe reduce the number of kids in the hallway. However, even though I may not be next to somebody for 15 minutes in the hallway, if I'm not wearing a mask and I cough or sneeze, I've now just exposed everyone within at least 16 or 6 feet of me if I were sick, okay? So I guess my plea to you and many of my staff and providers want me to raise this issue tonight is that please don't hang your hat on that 15 minutes because it takes about as long as it takes for you to sneeze to spread COVID-19 to whoever is around you within that 6 feet. So in particular in hallways, when you're pretty close to a lot of other people, you can spread a lot of disease very quickly if you're coughing or sneezing. So I ask that you please take that into consideration tonight.
And I just wanted to be clear that I just wanted to make sure that we knew our starting point. That our starting point included that 15-minute understanding. But I totally understand what you're saying, but I don't want it to be misunderstood that.
No, I get it. You just
that I
knew
think the 15
there was an
minutes-
opportunity for me to bring it up, and so
Yeah,
I wanted to
but I
do that.
just want-
Thank you.
How about the second component of that, Craig, the 6 feet? You know, is 6 feet hard and fast component, or is it more arbitrary, like 15 minutes?
So your viruses are transmitted through droplets, right? Droplets of saliva, mucus. Most of the time, I don't think it's all the time, and I'll ask Melissa to tell me if I'm incorrect or not, but most of the time, those droplets fall out of the air after 6 feet approximately. I don't think there's it is an absolute 6 feet. There are no droplets that spread beyond that. I think the risk of spread significantly drops beyond 6 feet.
Mhm.
Is that?
Anything you want to add, Melissa?
No, I mean, that's exactly what we have learned through all the training we've had with COVID-19 and other illnesses, the same thing. So the 6 feet is a good marker.
Okay, and what's the health risk? You brought up coughing and sneezing. So kids cough and sneeze. Do they take the mask off when they cough and sneeze, or do they sneeze into their mask?
The point is into the mask.
Okay, so if they cough and sneeze into that mask, now all of a sudden they've got mucus in their mask. What harm does that do to those kids? Nothing?
It's their own mucus. It came from their bodies. It's not going to hurt them.
So isn't there studies out there that by continually breathing in your own air, so to say, that people have developed pneumonia out of that or anything like that?
Not that I'm aware of.
I guess that's the struggle for me on trying to decide what to do, is that there's always two sides to every argument. And I don't know what's correct and what's not.
I have 40 staff wearing a mask for 12 hours a day, and no,
How often do you guys change your mask?
we wear one a day.
One a day.
We are conserving our PPE as much as possible, so we wear one a day. If you're patient facing, if it's soiled, you change it, however, so one a day.
I know Lori Jensen from Sanford's not here, but she's the director of the clinic in town. You know, on our call on Monday, she said Sanford's office personnel went to multiple days of even a disposable mask to try to conserve their PPE. So,
Yeah, I think she said the office staff, didn't she say they wear it like for 5 days?
they
4 to
wear-
5 days?
We're doing the same efforts. Administrative staff are wearing masks for 5 days.
And that's what we do at our office too.
The same type of mask you're wearing now.
Correct.
Thank you.
This is my mask for the week.
You can't see, but I'm smiling.
We're all developing nice smile.
Okay, so as we move forward, we can discuss whether or not we include the 15-minute rule, if you want to call it that, in that, any additional guidelines we move forward with. So how I think it makes sense, and I've discussed this with Brent and Andy, is let's start with, first of all, adding on to the existing requirements of extending that to preschool through 4. The second layer then would be expand it to hallways, passageways, common areas, with the exceptions that Brent notes here. And basically, these are, for the most part, the options, the other options to consider that Brent has listed out here. And then the third one would be extending a mask requirement across the board at all times. So let's start with what I consider is anyway to be the most basic, and we may vote to do nothing more than we do today. That's.
Hey, Dave?
Yes, Andy?
Hey, can I have the chance to chime in a little bit here on discussion before we would take any of those votes?
Sure.
Okay, thank you. So, COVID has affected me personally. As I speak with you guys tonight, I'm doing so from quarantine. As of this afternoon, 2 out of the 4 members in my household have now tested positive for the virus. Cases in the state of Iowa are skyrocketing. Our county's positivity rate is likely one of the top 5 counties in the state. I know that's changed on a day-to-day basis, but we're up there. Speaking from experience, COVID is here and it's real. I encourage my fellow board members to listen to our local healthcare professionals and take their recommendations seriously. They're the experts, not us. Our superintendent made a recommendation, and I can assure you that he has not done that lightly. In my opinion, this board needs to act. If we don't act now, then when? If we don't act tonight, we might not get another chance to help corral the virus before it really takes its toll on our students and our staff. It's the responsibility of us as board members to take steps to keep our kids on campus and in class for as long as we can. We need to pull that lever and make it happen. Our district needs to lead. It doesn't matter what other surrounding districts have or haven't done. I frankly don't care about that. We need to lead, set the example. Central Lyon can set the bar on this. Let's step forward and be part of the solution, not be part of the problem. Additionally, I'd like to see some support from our local leaders, our local businesses, and our community members to help stop the spread. I'm asking for our community to step in and do their part. Mask up, social distance, avoid large gatherings. Help your school district, help your kids. We can't do this without you. That sounds like I'm making an impassioned plea. It's because I am. When I look back at tonight, whether that be 2 weeks, a month, or a year from now, I want to know in my heart that I did everything I could as a board member to not only keep our kids in school, but keep our extracurricular activities on the calendar. With the recent developments surrounding tomorrow's state championship football game, I hope it's been reinforced to all of you just how important those activities are to our students, parents, and community members to keep those activities on the calendar and scheduled. For those reasons, and in consideration of which of these options is going to be easiest for our staff to enforce, I fully support Mr. Jordan's recommendation. Back to you, Dave.
Okay, thanks, Andy. Okay, so let's talk about the first one, that being expanding the mask requirement to preschool through 4th grade. So which would be when unable to socially distance, you must wear a mask at those times, with the exceptions as noted when in PE, band, well, preschool through 4 isn't band, but outdoor recess, eating and drinking. I don't know, do we want to put a caveat in there regarding the 15 minutes? I mean, to me, my personal opinion is it doesn't really matter. Time doesn't matter to me, in my opinion. That's just my personal opinion, but, so to me, it's, if you're not able to be 6 feet apart, then you should wear a mask, regardless of how much time it is. Again, that's my personal opinion.
And so that basically is saying then, in the hallways, lunch lines, and common areas.
First of all, it's just purely when unable to social distance.
Okay.
We're not, the existing requirement does not include hallways, lunchtime, etc. So essentially, what I think makes sense to do anyway is expand it to the existing requirement to preschool through 4. Make sense?
I would go farther than that. So I mean,
And that's okay, and we'll discuss the next steps, but I think what I'd like to do, and I think makes sense, is to layer it. And ultimately, the last vote that we have, or the last passed motion that we have, will likely override all the other ones.
sure.
okay? Or may, anyway.
So do we have any feedback? So we're asking to have our younger students participate in our current mask mandate. So with those younger, when we're talking, fourth grade, third grade, probably not gonna be as much of an issue, but when we get into the preschool and the kindergarten, how is that? What, do we have some feedback on what teachers feel, or how is that working in other school districts? But I know that they're gonna be touching their mask and bothering it way more than an older person
Yep.
is.
And so that's the, if you look at that, one of the elementary mask requirement surveys, that's the concern amongst your preschool, TK, kindergarten, first grade teachers. Is the constant touching on, off of our youngest learners, 4 years old till, 8 years old, let's say. And that's where the greatest hesitancy is amongst the staff. Yet, the proclamation that the governor put out, when we look at social gatherings or out in the public, it specifically identifies the age of 2. And I understand that kids in preschool are here half of a day, and all of our other kids are here for a full day. That's a longer period of time. But again, I think initially it's gonna be difficult for our kids.
How much are they able to social distance? Because right now, if we're at our current, if they're able to social distance in their classroom, they wouldn't have to wear their mask then. It's just when they are less than that 6
Right,
feet.
that's the first layer, is if you're able to be 6 feet apart,
Yeah.
you don't need to wear a mask
Yeah.
in the classroom. That was one of my questions too, is, I don't know the structure of those
Yeah, that's
preschool,
me too.
or early elementary
Mr. Harmon?
classrooms.
Mr. Harmon, did you wanna answer that question specifically about those preschool?
They are very large rooms, and they do have a capacity, they're not at capacity, capacity is 20 students per room. We currently have 12 to 14 kids in each one of those classrooms for the morning and 8 PM sessions. You're asking to corral cats, so, but, and that's where it's hard to say with those young kids, when they have their choice to go to their stations, they're not there 15 minutes, but that's, the time could be out. The carpet square time is there, but again, you're talking about an hour and a half block or 2.5 hours of time, and they keep it very methodical. If there's small groups or anything where it could be closed across the table, the teacher's wearing a mask, those aren't 15-minute time spans, that's where, as we worked through the school year from the beginning, that was something we really worked on, keeping the kids moving.
Yeah, but there's also some classrooms that have tables and some classrooms that have desks, right?
Correct.
And like you've been talking about, teachers have been rotating learning activities,
Right.
Every 10 to 14 minutes to try to reduce that, exposure when it comes to a time frame. And then other classrooms, as we get older in that elementary, especially 2nd, 3rd, 4th grade, have really socially distanced because they do have desks.
Right.
And have taken steps to get kids that 6 feet as best as they can.
Do our preschool and young, TK, I don't know how that's set up, but do they feel like there's maybe some different structuring that they can do in the classroom? So if there is more of that 6-foot distance, to me that seems like that and the hand sanitizing are most important. Maybe not most important, but are very important that we are trying to do. The mask, I see the benefit with the mask too. But if it's hard for those young kids to have masks on all the time, it sounds like in the preschool, it's gonna be, especially if the 15 minutes is not, like there's not a time limit. If we forego a time limit, it's going to be very hard for those preschool kids not to have their mask on all the time because of the way it's structured right now.
Right.
So are preschool teachers able to come up with some ways that they can maybe, at least for part of their time or more than what they're doing now, be more socially distanced so that those kids don't have to wear them as long as, I don't want them touching and doing that.
So I think what you're saying is, if we get to the point, and only the point of which we extend the current mask requirement to preschool through 4 and don't require them to wear it all the time, could we get to a point where we are social distance the majority at least of the day? Is that possible, feasible, Steve?
Yeah.
Tough question. I know like in our TK, which is or kindergarten, you may remember several years ago, while I was still here, we went from less desks to more tables. So that's where those TK and kindergarten and first grade rooms have a lot of what we call a hexagon table, where then they can cut them in half. So we don't have the option of supplying desks for all those kids. And that's where those teachers have been working with that 15-minute time frame that they're not in that desk. And like I said, you can't keep them in that desk that long anyway. A first grader, kindergarten doesn't have a 15-minute work span up to this part of the year. They may by the end of the year, but now they just don't. Is it possible? I mean, they'll do what we ask, you know.
It seems like we need to figure that out.
A lot of teachers have really cleansed their room. Is that a good word, Mr. Jordan? You know, we've.
I think they've taken
we've
the
used
steps that
Brenda.
they can.
Right. They've looked at things that maybe aren't as essential every time of the day. Large tables, kidney-shaped tables that they might use for one group and not another group. And they've looked at eliminating those to build more spacing, you know, so that they can get them around. Younger classrooms don't have that option, or just haven't had that option.
The nature of that primary classroom is a lot of centers and station activities. So I might be at the carpet as a whole group for a short period of time. Then I'm back at my table doing something maybe independently, but in proximity to my peers. And like Steve has referenced, many of those classrooms, we went to tables instead of desks. And then we might do a different activity where I might be in different sections of the classroom with different kids than I was at my table. But again, the learning environment for those primary kids is not independent. It's more collaborative and it's more small group. And it's frequently changing over the course of their school day.
Yeah.
And to socially distance even more in there is just challenging with the furniture that's in those classrooms. I think our teachers have done the best that they can to get them socially distanced as they can.
So why not take it away so they don't have to worry about that? Why even, hey, 15 minutes here and there, I would just have them try to wear a mask. I don't know, like I don't really want Colbeck's wearing a mask, but I don't want to wear a mask either, but sometimes these are just things that you work yourself into. He doesn't touch it as much as you'd think. When he was at the football game on Saturday when we were there, he wore it pretty much the whole time except for when he was eating popcorn. My first grader, he would take it off and he'd just walk off and forget about it. Like, I think if it's just sort of something that you get into, the kids are just gonna be able to pick it up a lot faster than I am. So, then you don't have to have the teacher worrying about, oh, well, I've had Susie and Colbeck's and Jimmy in the same group and they've been there for 5 minutes and now they need to go over here, but they can't, like, just,
Yeah, I don't
wanna worry about that.
Maybe to our point of talking about, I think that the time limit is irrelevant anymore. I don't think
Sure.
that,
So you're saying the time limit is, maybe I missed this, you're saying that there is no 15-minute time
Yeah.
limit? So
yeah.
basically, if we're sitting next to it and he gets it, it's an automatic that you're quarantined?
No, if you're wearing your mask.
If you're
then-
wearing your mask, right.
That's the requirement of whether you are required to wear a mask or not, is within 15 minutes, within 6 feet for 15 minutes or more.
But we're eliminating that 15 minutes?
I'm just,
That's
not
what I-
necessarily.
Yeah,
I think you're gonna cause more problems eliminating that 15 minutes.
to
Because
me,
we're gonna be
the-
back to the case then where we're gonna have kids that are getting quarantined. So of these 14 kids that are quarantined in the preschool, 11 new this week, are they all from that one positive case?
No,
So how many are
There's
from that one positive?
5.
5.
Yep.
If I could just add to what Joel was saying, is that okay? I don't know if there's Joel in regards. He's hit the nail on the head, the kids touch it a lot less than you think. It's basic child psychology that our kids model the behavior that the adults are showing them. And so if our teachers and staff are modeling behavior, the kids are gonna follow suit. Is it gonna be perfect 100% of the time? Absolutely not. I don't think anybody has that expectation. But if it's good most of the time, it's gonna be beneficial. And nobody argues or complains when it's required to go to a football game and cheer on a team. But they're complaining when we wanna keep our kids in school. Where are our priorities?
My issue with the preschool and first grade is, and obviously we want to keep these kids in school, but how much is having a mask going to hinder their learning ability? Because they're not seeing that mouth interaction. I've also been told this week that kids are playing with their masks at that young age a lot more than what you think, and it's disruptive in the classroom. I tell you, I'm sitting here right now, and I don't know how many times I've touched my mask already.
Yeah, so, to me, the advantage of doing this is with the current quarantine requirements, if you are wearing a mask and you're within that 6 feet, then you don't have to quarantine.
Yeah,
To me, that's the advantage of doing that, then you keep the kids in classroom, and they don't have to quarantine.
Are
It
kids
doesn't-
considered essential workers, basically?
Essentially, that's what the public health did 6 weeks ago,
Okay.
where if you both were wearing a mask, then the exposure only limits, or the only person that has to isolate is the positive person. But if, one is not wearing a mask,
And
then,
haven't we had faculty that has had a spouse test positive, but yet they can come to work wearing masks?
correct.
Is that a possibility? I'm just throwing this out there, that if kids are considered essential, and if there is somebody that tests positive and they're gonna quarantine, can't we at that point in time enforce a mask mandate and monitor their symptoms and keep them in school?
So,
I'll look to the healthcare, why not?
Kids won't, the state will not consider students essential.
Okay.
Nor will the CDC.
Okay.
But if I can just say one thing, we have public health nurses in every school district. And if you did choose to take the mask down to like your preschool and, TK and kindergarten, we can, utilize those nurses to do education with them too. And, show them the right way to wear their mask and how to take their mask off and not to touch it. I mean, that's what they're in the school system for. And we have very good results when we start teaching kids early on how to do things and why we need to do things. And like I said, they take that information and they take it home, and then we get better results from their household members. So, my grandson is, he's in TK and he wears a mask, and if he goes to the dollar store, he wears it, and he doesn't have a problem with it, and he knows he has to take it off by the ear loops, and those are all things that, I've taught him and his parents have taught him, and he does very well with it. So I think there's always opportunity for teaching and education if you decide to pursue that route, to where we can teach them how to wear them properly and how to take them off and on.
Okay, other questions, discussion? With this first step? Okay, then, if someone is comfortable doing so, I will entertain a motion regarding the, extending the current mask requirement to preschool through 4th grade. And do we make it irrespective of the 15 minutes? I guess that's up to the person making the motion. Or do you have other thoughts, Brent?
I think if we're changing the definition of social distancing, that gets us to what my original recommendation is in all times and in all places. So I think if we're gonna kind of layer these, maybe the first thing to consider is what is number 2 there, just extending it to preschool through 12th grade when unable to socially distance. And then if the board wants to go beyond that, then you can have a conversation about in hallways and lunch lines and common spaces. And if you feel like the, 6 feet or 15 minutes, you wanna go beyond social distancing, that would be what my original recommendation is. So I think it merits, a conversation or a motion to, like you're talking about, starting with the lowest level.
Right.
And whether that's preschool through 12th grade, or if there wants to be a conversation about starting in 2nd grade through 12th grade. And just put that out there, because I think that's what Carrie's kind of, suggesting based upon the feedback from teachers, about the youngest of learners, touching and having difficulty making it through a full day. But again, I think you can go a couple different ways with this. If
So
you're
like-
not comfortable going down to preschool, if you're more comfortable starting at 2nd grade. Because that's, another division within our building, where we've got that 2nd floor of that 1968 building starts with 2nd grade. Or if you wanna have the conversation about going all the way down to preschool.
I suppose if we wanted to, we could have another layer, go down to 2nd grade first, and then talk about it separately for preschool and then 1st grade. Do we wanna do that? I mean, I don't wanna get too segregated here and, do grade by grade by any means. But I think that there's some logic in that, Brent, where you say there's a division there where it's a floor.
Yeah.
2nd grade is a floor, so maybe it's 2nd through 12th grade. And if we wanna have a different conversation of preschool through 1st, that could be a different conversation. Is there a desire to do that?
I would be in favor of that. We're keeping the social distancing in play though, I don't think that we need to redefine what social distancing is. And then we're looking to our healthcare professionals before, and we're looking to them now, and I don't think it's our responsibility to redefine what social distancing is. So I think we need to keep that in play.
So is,
So that's just, so keeping it the way it is, but just going to 2nd grade.
Correct. I'd be in favor of making that motion.
so Melissa, before we do that, Melissa, is the current public health stance on social distancing, does it include that 15-minute element?
Close contacts, that's the definition of close contact. So
Okay.
close contact is somebody who's within 6 feet distance of a positive person for 15 minutes or longer. That's the definition of close contact. Social distance is 6 feet apart.
Okay, so social distance has nothing to do with time frame.
No,
The close contact in terms of even
close
needing to
contact
quarantine.
has the time frame.
Okay.
Yep,
Okay.
yep.
Okay,
I think Scott had a
Okay.
motion.
Correct.
so you want to state?
I would be in favor of making a motion, extending the mask mandate as is and including 2nd, 3rd grade.
2nd, 3rd, and 4th.
Yes.
So it'll be 2nd through 12th grade.
2nd.
Existing mask requirement of, if you're not able to social distance, must wear a mask.
Correct.
Okay, so that's Scott's motion, is there a second?
So just so I understand our process here, if we second that, then we're continuing the conversation.
We will continue the conversation and consider preschool, kindergarten, and 1st grade as well.
We're
So
we're just
purely
trying to
what
kind
we're,
of-
so purely what we're considering at this point is, do we extend it down to 2nd grade?
Don't we have to vote on it? If there is a motion and a second made, don't we have to vote on it
Yes.
first before we?
Yes.
Okay.
And purely what we'd be voting on at that point is, are you in favor of extending it down to 2nd grade?
so
You may be in
adding
favor of more than that.
Okay, so you can be in favor.
So essentially, you're amending
Okay,
the current policy, like we're kind of doing right now.
Right.
so
We're
if we
just
say yes-
layering.
So if we say yes to this, we can agree to more.
Exactly, exactly.
Okay,
Unless
So-
it's, unless 3 of us voted in,
Yes.
then are we gonna continue on and we can continue on, okay?
we'll then have the discussion, after this, then we'll have the discussion about extending it down to preschool through second.
And there's additional extensions that could possibly lead to hallways, lunchroom,
Yes.
all of those things.
So we could have 10 motions and votes tonight,
Well, I hope it's not that many, but,
but that's the route we're going right now.
well, and
Potentially.
my opinion, and we can do it differently if someone really wants to, is I wanna structure it so that we understand where we have agreement and don't have agreement. So let's at least
Very good.
get it to a point of, let's agree on this, have the next conversation to have a potentially more restrictive requirement.
Okay.
So as we go forward, we'll talk about more restrictions. At some point, we're gonna hit a stopping point.
So I'll second.
Okay, so we have a motion and second to extend, I'll go back to Brent's number 2 and say, students and staff in grades 2 through 12 be required to wear masks when unable to socially distance, with those exceptions as noted under number 2. Agree, Scott and Carrie?
Yep.
Okay, all in favor signify by saying aye. Aye.
Aye.
Opposed? Motion carried. Okay, now let's have the conversation about extending that down to preschool, first and second grade. I'm sorry, preschool, kindergarten, first grade.
So like with our quarantine kids, when you look at those grades, there's 27. So how much is that? I know that it can't be more than 12, or because of school, but is the 12 in those grades? Because we only have 12 that are
computer and I can tell
close contacts at school. There's 27 there.
What are you looking at?
This year.
Oh, I see what you're saying. You asked how many of those are close contact from school?
from school. Seven of the 12 that we currently have, close contacts of school are quarantined from preschool through
This grade?
first grade. And then from second grade through fourth grade is your other 5. Or second grade through fourth grade, your other 5. Yeah, that's what I said it, wasn't it?
Okay, so if we had a mask mandate, that's currently what we have in place, what we just agreed to then those 7 would have been able to stay in school,
5.
or 5, those 5. Well, well,
7 preschool
yeah,
through first
if we do it
graders.
for preschool, then there's 7 kids, preschool through first grade, there's 7 kids that would have been able to stay in school then.
No. 5 currently, second, third, and fourth graders
Yeah,
were deemed to have been in close contact because of a positive case.
right, but then there's 7 in preschool through first grade that had to quarantine because of close contacts in
Correct.
school. So if we extend that
7,
down further, then that's 7 more kids that wouldn't have had the quarantine. Because right now, we've just let 5 more.
Yeah.
You know, would have been able to stay in school. This would have been in place then. Okay.
Okay, other comments, questions regarding preschool through first grade?
No, but I would make a motion to move it down to preschool through first grade.
Okay.
When unable to socially distance.
So essentially number 2, just like we talked about, but extending that down to preschool.
For now, yeah,
And again, that's all, we're just taking in steps. We'll talk about more restrictions
sure.
going forward. Yep. Okay, we have a motion by Joel. Is there a second?
I'll second.
Okay, we have a motion and second to extend the mask requirement as stated under number 2 down to preschool, including preschool, kindergarten, first grade. All in favor signify by saying aye. Aye.
Aye.
Opposed?
Aye.
So 4-1, I think Carrie, you voted in favor, correct?
Yes.
Okay, 4-1, motion carried. Okay, so now let's just discuss, I believe it's number 1. Extending the mask requirement to be worn in hallways, lunch lines, and other common areas with those exceptions as listed. And again, we'll discuss a full mask requirement after this, but this is just to me, the next step is requiring it in those common areas. So
At
whether
all
you're,
grade levels, or where we,
pardon me?
are we going all grade levels with number 1, or are we?
Yes,
We-
because we
we-
currently now,
we-
we passed the requirement to be all grade levels, when unable to socially distance. Now, I think it makes sense to discuss in all grade levels, masks in those common areas, et cetera. And again, if there's a big desire to segregate it, again, I don't wanna be here and make 15 different motions, but at the same time, if there's a reason to do that, okay. But at this point, I would suggest we keep it one conversation at this point and doing it through the entire school. Okay,
I guess I would argue there's probably not a lot of socially distanced people when you're standing in line next to somebody or when you're passing in the hallway.
I would agree.
To
What's
that,
the
to that extent.
eating scenario, especially in elementary, I think we've done a pretty good job in the high school of doing that socially distance, but what's it like in the elementary?
The lower grades are socially distanced because they have just a few, they have one and a skip, and I mean, they got more space. When we get into the upper grades, they are still potted with 3 or 4 kids in an area, and then skip a chair and that.
I would assume lunch takes longer than 15 minutes.
That's correct.
Is there any way to, and I know our space is limited, but is there, and time is limited, is there any possibility to extend that?
Currently, lunch starts at 11:10 and goes till 12:30. And so if we were to go further with the lunchroom part, then we would have to start earlier or go later.
Or kids could eat in their classrooms.
So that's like the only next option would be just to, they're not leaving their classroom out, really, I mean, I don't think.
You'd walk down to get your lunch and then head back. And then we potentially could space more. You know, like you said, you could start earlier. You could start a little bit before 11 and you could go, high school eats up until after 1 o'clock. You know, I know that's a long time to wait if I'm a
Without a doubt.
5th or 6th grader.
Yeah.
So I don't know how much longer we want to extend that.
Or you could rotate who had to stay in their classroom. You know, okay, on Monday, this person's section had, all the first grade was staying in their room, and they could come get their lunch and go back, so that the other groups could then have more room to be able to spread apart. And I think that would be a possible solution to something like that. 'Cause
So
I-
right now, we can have a close contact at lunch.
Right, because I think from where you're going, at least with that question.
Because we're doing the mask mandate all day
Yeah,
long,
yeah.
and then in the lunch.
Yeah.
But then in lunch, it's a free-for-all for 25 minutes or whatever. So I hear what you're saying in that sense, so, you know, there's probably a solution to it out there since we talked about it a little bit. Yeah, I don't think anyone wants to be eating lunch at 1:30.
No, I agree,
But,
I agree, and I know it's limited to what we can do.
Yeah, I think you do the best you can, limiting it to, you know, trying to space them out as much as you physically can. Obviously, there are limitations, do the best you can. You know, when they're done eating, you know, get them, if they can go to recess right away as soon as they're done eating, or, you know, rather than, and I don't know what you do now. Do they have to stay there in the lunchroom for X number of minutes?
Correct.
So maybe you let them go sooner, you know, as soon as they're done eating, maybe you let them go. And I know that can be chaos, but it just some thoughts anyway. So, you know, something to think about. I don't know that we want to try to do, you know, the close contacts in terms of, you know, we're making it the exception for lunch. So I think you made that exception.
Yeah, I think we have to make that exception, but I think we need to try to eliminate the possibility of close contacts at lunch if we can.
So would we, so if, if kids, two kids were sitting next to each other for 20 minutes, let's say, at lunch, would we consider that to be a close contact? If you're doing contact tracing at that point, is it close contact?
Because they're within 6 feet distance of one another for 15 minutes or longer.
Okay.
So each table has 18 seats. If we would go to a true 6 feet per person,
Yeah.
we would get 6 to 8 kids per table.
Okay.
So I cannot run that lunchroom the way we do. We would have to go to a scenario where we go to their classrooms.
Like you said, a rotation of, like
Sure. Half the
Joel's
class.
already talked about.
Right, half the
A
class.
certain section of
Sure.
kindergarten meets at this time.
Which, and part of the, I guess part of it too that comes in is when you have people in pods, you know, when they're in their classroom, then that's, I mean, that's, you might end up close to somebody or whatever, but then you eat in the same position so that if there is a positive case that way too, you, and I think that would still probably maintain, it makes sense to continue to do it that way, but yeah, I guess it would just have to be a solution of, yeah, if we're gonna try to alleviate having, you know, people be contacted that way, having a mask, then look at alleviating all of it if we can. There's gonna be an assumed risk and not everything's gonna go 100% and that's where we're at. But I think we'd like to,
But we have to just do as much.
I think we'd like to, you know,
Yeah,
continue to keep kids in
I
school
mean, and
for whatever reason.
And when I say that it's, you know, I don't wanna be in that close contact, cause I don't want kids quarantined, but it's also, I don't want the disease spreading. So if they're
Right.
saying
That's the
that,
ultimate goal.
that we're within,
Right.
you know, I just kinda use that phrase, I guess, the close contact, because I know that's when you can transmit it most likely. So. It's.
If I can chime in here real quick, one thing that I want the board to think about and be a little bit careful with is, we're gonna be asking staff and administration to enforce this. So, you know, I would encourage you to think about, you know, not making it overly complicated and, you know, consider that how many debates are we gonna be having in the hallways between students and staff about socially distancing and everything else. I've already kind of noted where I stand on it, but I really want you to consider the enforcement aspect of this to just make life easier on our staff.
Yeah, I think we do as much as we can to limit the 15 minutes exposure, whether that's trading off of when they go to lunch or eating in the classroom or letting them go as soon as they're done eating or whatever the case is. That's up to you guys to figure out, I think. So,
I'll
Okay.
just chime in real quick, and I agree with you, Andy. Trying to keep this as less complicated as possible for our staff and everything like that, but I'm gonna go back to the whole preschool first grade scenario is that we wanna make it easier for our staff to do it, but I think by putting that mandate in place, that we're making it harder for those teachers to teach those kids. So you gotta look at both sides of it, in my mind. Because we are talking.
Well, for
we are
sure,
talking
Scott,
about, you know,
I think we all understand that, look, the preschool kids, first grade, second grade, it's gonna be tough. And we're not asking, you know, teachers to run a prison camp when it comes to masks. I'm simply asking them, since we have that passed, to do your best. We understand that the little kid, little Johnny's gonna be bebopping around the room and his mask is gonna fly off and that's just the way it is. So certainly see the point there, Scott.
you leave it subjective doing that, because what one person thinks is their best, and in that scenario, the person walking by the classroom is thinking, well, they're not doing their job, because they're not enforcing it as much as they should, is all I'm saying.
Well, I think with keeping, you know, having that socially distanced part in there, then we look for opportunities where we have that 6 feet so that we don't have to have that mask on all the time, unless we go, you know, to that next step, because I know that's coming. But at this level, that's where I'm at with that, is if it would stop here, it's that, okay, if I'm a teacher in the class and I don't want my kids to have their mask on all the time, then I'm gonna social distance a little bit better in my classroom so that my kids can have those breaks, if I feel that that's how I wanna run my classroom. But if I wanna run my classroom where we're together more and wear our masks all day and my class can do that, then that's their choice. Because everybody kinda has a different feel for that and how they wanna run it. So, that's, at this level, that's what I think.
Okay, so we're, any more discussion about requiring mask wearing during, between classes, common areas, et cetera? If not, is there a motion to approve that additional requirement?
I'll make a motion to approve that additional requirement.
I'll second.
Okay, we have a motion and second to approve the additional requirement of wearing masks preschool through 12 in hallways, lunch lines, common areas, et cetera, with the exceptions as noted. Essentially, this is number 1 under Brent's other options to consider. All in favor signify by saying aye.
Aye.
Opposed? Motion carried. I don't think there's any other things to consider other than the complete mask requirement at all times in school with those exceptions as listed in Brent's memo. So now we're up to the very top of your memo, the first bullet point, which is students and staff in grades preschool through 12 be required to wear a face mask while at school, regardless of staff or students' ability to socially distance, with those exceptions. Comments, questions, discussion?
So I feel like the CDC and the public health guidance is to wear a mask when you can't socially distance. And so I don't know, I know that there's a big push from the medical field asking us to go above that. I don't know that I'm comfortable going that, asking the students and staff to do more than that guideline. I think it's very much encouraged and you're very much free to and can choose to wear that when you are socially distanced. But I don't know if I feel that I'm quite ready to say that I think even when you're socially distanced, you have to wear your mask.
I agree with Carrie 100%. I think the socially distancing, the CDC, we've gone to healthcare professionals, and they still have that mandate in place that if you can socially distance, you don't have to wear a mask. I'm not ready to, I'm not in favor of making our students do that at this time.
You're quoting the CDC incorrectly, however, that says right here on the CDC website, masks should be worn in addition to staying 6 feet apart. But
Okay,
I think
I'm not
we're-
gonna get into a discussion about that. Molly, let's keep the discussion here. We can get into disagreements, agreements, et cetera, all night long. Let's keep the conversation here.
Dave, is Mr. Holmes still there?
Yes, sir?
If I can ask a question, are you supporting Mr. Jordan's recommendation tonight that we're discussing right now?
Yes.
Okay, I thought I heard you say that in your statements, but the audio a little choppy here. Thank you for that. I think we have to listen to the CEO of our hospital. He's the medical professional. He's the expert. We're not expert. He knows what's going on. He's got the boots on the ground. He's got staff. So I'm in favor of this.
The one thing that I'm gonna go back to, and I agree with you, we should listen to our medical professionals. Craig, however, also stated in his statement that again, the CDC has said, and we think that it's 6 feet is where the droplets typically fall off, in that 6 feet range. It's plus or minus likely. So I kind of go back to your point too, Scott, and in what one of the things you said certainly supports what you said, Scott. Obviously, you said many more things than that, Craig. I'm not belittling that by any means or anything like that. So, okay, so I think we've had conversation.
I guess to me, I think the reason I'd be more in favor of favor of having it just be throughout it so that to take away, I don't know, not take away, to encourage students to just have it on and say, okay, wait, now look around and I'm close, I'm not that close, I'll move away. It's just, they're not gonna have to think about it once you get used to having it on. I guess is kinda how I see it. It's gonna suck being a teacher, especially in the lower grades, and I understand that. Because I'm trying to teach Sunday school at my church, and I wear a mask when I'm in the room because we're not able to spread out in the classroom. And it's harder to hear, it's harder to breathe, no one can see you, it's harder to get kids engaged, and I get that. But so I feel bad. I'd like to be able to put like a PA system for every elementary teacher, just to be able to have, so that the kids can hear what they're saying. But I think for the time being, in order to help encourage kids not to be worried about where they're at or taking it on or taking it off and touching it all the time, I think it should just be an understood thing of you come into the building, you're gonna have to wear it, whether you're, unless you're a couple of exceptions in PE, band, and having lunch, you get a water bottle drink, then you put it back on. I think that's just the commonality of where I think it needs to be for now, and there could be a sunset date at some point, but not anytime soon. I kind of see the school as a conduit through which a lot of things get spread. I don't know that a lot of kids are gonna be symptomatic in some of that, and I worry about their parents and about the teachers and grandparents and things that get happen through the school, and I would like to see the school be open and gathering as much as possible. We hear about schools that are, I have a friend in Denver, and you hear about Rapid City, and they're going to distance learning. I want no part of that as long as I can help it. And I think this would be, I guess, the direction that I would also lean to go, to do that.
I'm gonna put my 2 cents in. I don't wanna sound like, and I know I've had a lot of negative comments, maybe that some people are gonna perceive that way. I know the pandemic is real, I know there's people getting sick, I know our hospitals are being overrun. But from day one, in my perspective, we have said that we're gonna follow the guidelines of what is stated. Now, I know we have somebody here from the hospital here that says we should go above and beyond, but we've always taken the stance in the past that we're gonna follow CDC guidelines and stuff like that. And now we're going to go above and beyond that. And then I think we're going too far, because, and I understand the parents' perspective where they want everybody to wear a mask. There's people on the other side of that aren't requiring those kids to wear a mask. It's everybody's free choice. If they wanna walk in that door, wear a mask 24 hours, that's their choice. But if our kids can socially distance, and they're not putting anybody else's health at risk at this point in time, I don't feel the need that we have to go above and beyond what we have been guided, because we've gone with the guidance of public health and CDC in the past with what is written and what is given to us. And that's been our stance from day one, and I know we've got a lot of positive cases and stuff like that. But we're also talking about children who are highly unlikely to develop any serious complications from it. I believe there's 99.99% of kids surviving this. And a lot of it is just the common cold. And I know there's gonna be instances where it's a lot more, but we as a society also have that free choice to decide if we wanted to go out in public without a mask. And it's also that person's, if there's health risk and stuff like that, and I'm starting to ramble and I apologize. But there's still that free choice, and we've got to look at both sides of it. I'll leave it there.
I think wearing a mask all the time for some, and maybe a lot, is easy, but I think there's some that's very hard for them. And then to force them to have to do that, that's tough for me. That's a,
There will be some that will be very difficult.
yeah.
Yep.
If not, some cases impossible.
And so this kind of, even if most of the classroom can't be socially distanced. If the teacher has a few kids that's a problem for it, they can social distance those kids to give them breaks. You know, I just feel like it gives a little more flexibility and, you know, whatever, there's lots of scenarios, but I don't know. I'm still gonna say, you know, I still feel that I'm not quite ready to go all day, every student, all the time. I feel like the close contact part of it still says you wouldn't have to quarantine if you are wearing a mask and within 6 feet. You wouldn't have to quarantine, but if you are outside of 6 feet and not wearing a mask, you wouldn't have to quarantine then either. So that makes me feel comfortable that they feel that 6 feet is something that's important also. So beyond that 6 feet, not wearing a mask, they're saying that you're okay. And so I feel like in the school, I can say that's okay also.
So how do you picture that playing out in a classroom then, if you would?
Well, right now it is playing out in the classroom, in the high school or middle school. That's reality for them right now. They are socially distanced, and if they're not, then.
So they would wear a mask on their way into the classroom and then take it off when they're there,
If they're 6 feet apart.
if they're 6 feet apart, and then put it back on before they go out in the hallway again.
Yes.
I think that we also, I mean, we're talking all about masks, but I think it's very important that we are hand washing and sanitizing. Like, that's a key part of this also. And kids do have to take their mask on and off properly.
Sure.
And they do need to handle that. And so we do have to try, and if we have the nurses that can help with that, then we have to utilize that. And we have to, the kids are smart. They can do this. And I know that there's that risk. I think what you're saying is the more you take it on and off, the more you're touching, and you know, and so that, and I see that part to it too. But I think that they still need to have that free choice. And some, if their parents tell them you should just keep that mask on all the time, then they should, you know. That's gonna have to be, I don't feel like I can make them or expect my teachers to make them.
Could I have a comment? Sure. Molly's comment was accurate, that the recommendation is social distancing and masking. It's not one or the other. So I just want to clarify that. The other piece, I wholeheartedly agree, masking is not a replacement for any of the other mitigation efforts. It is purely an addition to hand washing, as you pointed out, sanitizing, social distancing, all of it together is what gives you the best result.
But still, the close contact is only if you're within that 6 feet and not wearing a mask.
15 minutes
And
Or 15 minutes.
over 24 hours with the CDC.
Well,
But
But
I think
Iowa
what
public
Michelle's
health-
saying, or excuse me,
Iowa
Melissa is saying,
public
sorry,
health
Iowa
doesn't-
public health
Iowa is, it's gotta be 15 minutes continuous contact, correct, Melissa?
Yep.
For quarantine, for close contact.
You know, one thing I would point you to again is, you know, the teachers that have been implementing the mask requirement while unable to socially distance. Again, 30 of the teachers, 22 of them said they'd like to go even further. So, I don't know if Jason wants to add anything on any, you know, conversations he's had with staff, but that's where the enforcement component becomes really difficult in the gray area that's been inherent with the 6 feet and 15 minutes.
I would agree there. It is much more difficult right now to enforce the current mandate because of the gray. Whether, you know, the hallway situation or the lunch line situation, coming into the classrooms, there is some grayness to it. And it's very difficult to enforce because it is creating some animosity amongst class to class. One teacher requires it and is doing a very diligent job about doing it. The other one, maybe we're not doing as well. And I would totally admit to that. Because there's gray to it. there is so much gray.
But didn't we vote in now that
You are the
that
one.
hallways, lunch lines, and common areas, you have to wear masks? So that part.
Sure.
This page.
That should be black and white.
Yeah,
That's
black
so,
and
so we
white
do, I do appreciate that, that is the black and white, so I do appreciate that.
So I want to go back to your comment that you
Yep.
made a minute ago, Jason, about there being some teachers, and I'm not sure exactly what you said. Some teachers enforce it, some teachers don't, or
Some
some
teachers are
require.
going a little bit more because of the comfort level, because they're doing more frequent interaction with kids, and so it's not just, you know, I'm not 6 feet at all times. You know, because we spaced it out so much, you can't avoid to teach a direct instruction lesson without being that close to some students who are already 6 feet socially distant. So you are asking a little bit above and beyond at some time for them to mask up, just to protect, to keep everybody here at school, basically. So that's kind of what I mean by that, is where it's a little bit easier in some classrooms because of the space, because of the equipment. You know, our science classrooms are very tight, we have labs, we have tables. It's exceedingly difficult, and those kids do need reminders every day to wear a mask. And we've gone through plenty of masks here in the middle school and high school. So I would say my conversations with staff indicate very much what the results here indicate, is it's going to be, we believe, easier to enforce, much more, you know, less gray if we do what you already did, especially in the hallways, and it'll even become less gray the further we go in the classrooms.
And, I mean, I can recognize that, I totally is a valid point and everything. I just feel like this is a big step that we're taking now, so let's take this big step. Let's see how it goes. If it is not going well, we can meet again, and we can, in a couple of weeks, you know, the governor's mandate is through December 11th. Can we try it for that amount of time, see how it goes? If we still feel the governor might have more mandates at that point, or maybe things are going better in Iowa and she's able to back off on things. I don't know how that will go. But we can reevaluate. This isn't we're doing this and this is how it's going to stay. This is just kind of a first step. Let's see how this helps, how this works.
Something might change next week.
Yeah,
I mean,
it could, very well.
Hey, Dave, can I chime in real quick again?
sure.
I just wanted to say that I really appreciate all the healthy debate we've had tonight. A healthy, respectful, professional debate. There's a lot of city councils, school boards, everything else that they don't handle it nearly as well as we do. So I just want to commend my fellow board members for keeping it positive.
Yes, I would echo that as well, Andy. Yep, and whatever we decide, you know, it's as we have always done, we move forward as a board and as an executive team, and we march forward, so. Okay. I think, any other discussion? I think we've kind of beat this one up. So is there a motion in support of Brent's requirement as listed here?
So moved.
I'll second.
There's a motion and second to approve Mr. Jor's requirement of requiring students and staff in grades preschool through 12 to be required to wear a face mask while at school, regardless of the student's or staff's ability to socially distance, with those exceptions as listed. All in favor signify by saying aye.
Aye.
Opposed?
Aye.
Motion fails. Next on the agenda is announcements, dates to remember.
Wish the football team the best of luck tomorrow afternoon in state finals. And everybody else, a very stress-free and relaxing Thanksgiving with their immediate family and whomever else they gather with next week. And like Andy said, appreciate the debate and the honest conversation, and we move forward together. And the principals and I and the teachers do our best to enforce the new mask requirement for students and staff.
Okay, is there a motion to adjourn?
So moved. Second.
Motion and second to adjourn, all in favor signify by saying aye.
You got me on that.
Aye.
Your closest, close
Thanks everyone for
contact.
attending. Goodbye, Andy.
Jackie, do you need this?
Yep.
No, there's nothing on your agenda.
Thanks, Craig. Melissa?
Yes, thank you guys for coming.
No, I
Appreciate it.
I
Take care.
did wanna let you know that with the governor's proclamation, if there's a person who's doing an educational presentation or performance for an audience, such as a classroom, if the teacher's in the front of the classroom, they can't take their mask off so the students can see their tongue.
Okay,
She made that exception,
okay,
so.
that's good to know.
And then if anybody is deaf or hard of hearing, or has a disability or medical condition or mental health condition that makes communication difficult while wearing a